You are listening to Hilary Topper on Air, the small business podcast to help you grow both personally and professionally. And now, here's your host, Hilary Topper.
In the early weeks, COVID-19 threw us all for a loop. From March to practically July, we were on pause. As businesses reopen and we try to attempt to some type of normalcy, we need to look back and ask ourselves, what have we learned from this pandemic? I'm Hilary Topper, and this is Hilary Topper on Air. Today, I have the great pleasure of speaking with Robert Fallarino, trial attorney at the Pegalis Law Group. Bob will be talking about the differences between the height of the pandemic compared to the current day, the risks for the elderly and younger patients, what your legal rights are, and if you or your loved one had any kind of questionable treatment during COVID-19, and finally, how to protect yourself in the event that COVID-19 occurs again. Today's show is sponsored by the Pegalis Law Group, and thank you so much, Bob, for being on the show.
Well, Hilary, thank you for having me. I appreciate the opportunity to speak with you all about this.
So, can you refresh our memory about you and the Pegalis Law Group?
We are predominantly handle medical malpractice matters on behalf of the patients and all aspects of medical malpractice, from cancer-related injuries to neurologic and birth injuries, and then anything in between. So the whole gamut of things that would evolve around medical care, either in the inpatient or outpatient setting, where you had any questions about whether things were done appropriately and whether it caused serious injury to you or a loved one.
So let's talk about COVID-19. What are the differences between COVID now in New York versus the height of the pandemic? And I know COVID right now is all over the place except here.
Yeah, well, we had a little tick up yesterday, according to Governor Cuomo. He said there's 1.04 instead of under 1 per each person that has a positive infection now is infecting another more than one person. So it's we had a little uptick yesterday, actually, believe it or not. But right now we seem to be in the phase that everything's kind of holding still. We're not getting a peak. We've been saying, the wave has been slowed and maybe lowered a little bit, which is excellent. Deaths are certainly down, so clearly some of the physicians and healthcare have caught up to some of the issues that are involved in it. So, it's a situation now. The key is the safety precautions that we're all following, making sure that we keep doing it so we don't have that uptick that the West and the South is experiencing right now.
So if somebody gets COVID-19, how can people protect themselves this fall?
Well, it seems one of the interesting things that came out of a recent study from the New York State Department of Health is some of the nursing home patients, which seem to have a concentration of the COVID in terms of the percentage of patients there. It seemed to have been spread by the healthcare workers themselves. In other words, a contamination from maybe one patient getting it or a healthcare worker bringing it into the nursing home and then spreading it due to the close contact. So we sort of have an understanding now as to how it spreads, and it has to do with viral load and then coughing, and that's why the masks are so important, sneezing, coughing, and even exercising. If you're riding a bike or running, the deep breathing that you're experiencing, you actually can inhale a more higher viral load than if you weren't doing that. So you have to be careful in terms of distancing and all those kinds of things. But so the interesting thing that we've learned recently over the course of the last couple of months is really how it spreads and how you can really protect yourself by the masking, by the social distancing. The symptoms are the same. There's not really a grave in change in the symptoms. You know, they're flu-like symptoms that they first start. We still believe, I think everyone still believes it's a 14-day process from when you might be exposed to when you have symptoms, and that's why the quarantine is 14 days when you come from another area or an area that has a high rate of infection at the current time. And so I think what we've learned in New York is kind of held true from a population standpoint. The key is really when you have it, if it's mild, it'll last around 2 weeks and you'll just run through it like a flu. But when the symptoms start to increase, and certainly when there's real respiratory issues, that's when you really need to get health, to be jump on it. And it can come on suddenly. So if you start having respiratory issues that are beyond just a cough, that's the time to make sure you get healthcare involved, because time is of the essence at that point, to make sure they catch it and support you.
Now, not everybody ends up in the hospital after getting COVID, but those who do, and if the hospitals are packed like they were, who decide? I mean, do the doctors have the right to decide who lives or dies in these overpacked situations in the hospital?
And in essence, what happens in those situations is no different than triage in any other situation in terms of making the informed decision. I don't, the real problem comes in not so much, I agree with you with that phrase, who has the right to choose, but the issue really is, what level of care does someone need? And luckily we eventually did get enough of the respirators so that we could supply it to everybody that we wanted to. But the key with what I think we've learned is the key would be identifying people who are going to go downhill fast. And if you don't have a respirator, you don't have the appropriate equipment, whether you're going to use more advanced equipment than you have available, is transferring them. And I think the transfer system is one of the things, either getting the respirator delivered from a hospital that has extras, or transferring your patient over to the place that has the equipment. So that's where that right to choose is important, is sort of the physicians have to be a little proactive and anticipating who's going to need this equipment. Do we have enough if you have 10 patients that you think are going to need a respirator and you only have 8, you either better get 2 more respirators, or you got to send 2 patients over to a place that has them. So that's sort of the avenue that you'd be looking at, is were they thinking at it appropriately? Were they thinking at it from the patient census and population? And were they adjusting their needs based on what was going on? And I think as we move into the fall, and hopefully we don't, but in the fall, if we get a little bit of an uptick, I think what we've learned in the spring, the healthcare providers will be much more proactive and vigilant in terms of doing that. And hopefully, and if they're not, that's where you have to be a little proactive when you're there as a patient, saying, what's going on? What are you doing? What do you think the next 10 hours are going to be like? What do I need? Do we have it? And so you'd be a little proactive. Even though you're sick, make sure you have to advocate for yourself, because you're alone. This is the one time that you won't have a family member or someone there that can speak for you. So you have to have the checklist kind of in your brain a little bit, so that's one of the things that we'll have to do.
That's really important. What happens though if you're unable to advocate for yourself? You're so sick, you're on a ventilator, you just don't. Then what do you do in that situation where nobody's there and you don't even know, like they don't know how the treatment is going and that type of thing?
Mm-hmm. Right. And that, with the inability of family members to be there, at least at the current time, that's a very difficult situation. And that's where hopefully you have a family member that can get the social worker involved, get the people at the hospital that are involved in patient advocacy, get them involved at that stage. There's, on Long Island, we have some of the iPro groups and things of that nature that will advocate for you, that if you can't even get through that, we'll be able to, try to get someone on the line for you. But I think if you're someone that really doesn't have anyone available to you in terms of a spouse or a loved one or a child that can really advocate for you and is on the phone, I think when you're first there, you should ask for a social worker to speak with them. And so that there's someone there that knows who you are, knows how your baseline is, and can say, hey, this is a lot different than it was 2 days ago. And I think that would be one way to protect yourself, especially if you're alone.
Great advice. So what are your legal rights if you or your loved one had some kind of questionable treatment done during a COVID-19 hospitalization?
Well, it's very interesting. You do have legal rights, but there were protections put in place for the healthcare providers, and rightly so. This was something that was new. They were going to be overrun at some level, so they need to have some protection. So the governor, and when it was passed legislation in terms of the concept that you have the heightened level of proof. There has to be really gross negligence, but that doesn't mean there's no rights or remedies if you think something was done incorrectly. It just means there's a heightened level of proof. So if you think there was something done incorrectly, and it certainly as things progressed, I'll give you an example of something that was going on early on, that if you were the first 4, 5, 10 patients, that they wouldn't understand it. But what was happening was everyone's lungs who was needed respirators were some reason being damaged. We've learned over time that may not be actually lung tissue, but it might be some clotting issues involved. But it seemed to be underlying illnesses. But what was happening was they were setting the ventilator when they actually put the tube in and were breathing for the patient. They were setting it at normal settings, and they were actually blowing out some of the tissues of the lungs and causing collapsed lungs and more complications. And that had to do with not knowing the process. Maybe China didn't give us a lot of that information, and things that, so we were, our healthcare professionals were learning that on the fly. Now so let's say you're patient 1 and that happened to, that's where that gross negligence standard may be hard to hurdle. If that happened to you last week, that would be gross negligence, because everyone should know about that already. The other issue that we've seen is about a month ago, middle of June or sometime around there of 2020, they've learned that they have a 3-prong process to treat patients. What I was talking about earlier is they seem to think there's some sort of blood vessel, arterial component to what the virus attacks. And that's why people with cardiac issues and diabetes seem to have worse times. And that's also why sometimes the kidneys are getting knocked out as a first element of multi-organ problem, because that has years of abuse if you're a little bit under not the best in health condition. So they've learned that they're giving a blood thinners. They are now given dexamethasone, which is a steroid that's used a lot. But those two things, that one is to protect against the steroid is an anti-inflammatory, systemic anti-inflammatory, to calm down the inflammatory response. And the blood thinners, obviously, to allow the blood to go through and not clot in these small arteries. So what was happening, and even like in children, I think they really learned that from the young children. If you remember the first scenes when they would show the children, it was blotchy feet or red or purpley feet, and they didn't really understand why infants were getting that. Well, that was a coagulopathy. That was a blood issue. And so this combination, and if those patients also need to be intubated, they've learned to put them prone intubate them and use the respirator for them, but to make them prone, to make the fluid accumulation easier to drain off. So it's a very interesting process that, they've gone from not knowing anything to going through that process. And now this is the way they're treating people, and they're doing much better. And, so it's a very, and there's a very interesting, and it may be coincidental, or it may be, something that they can look at. But in New York, because so many people are on Pepsid and those anti-acid kind of things, what it would seem to be that some people responded very well anecdotally in New York, if they happen to have taken Pepsid right before they came to the hospital, their daily dose of Pepsid, and there's no, I'm sure that someone's going to investigate it and do a study if that's true or not, or that just so happened that those people got better. But there might be a little anti-inflammatory process with the Pepsid that kicked in the inflammatory response in the body, and maybe made that showering, that cytokine storm that you get from infections, less severe. In some minor way that maybe we can investigate and find out a true answer. So that's that's a little interesting. That's a little tidbit that kind of is coming out of it. The other interesting thing that is now they're starting to do a push for is all the stress related issues associated with COVID. Because I think they're focusing more on women, and women who have especially children at home, where there was a lot of added stress in terms of the home care, you and your spouse, so less income coming in, taking care of the children. And I think, you can deal with that for a month and 2 months and 3 months, but as it's piling on, they're very worried about that. And in a combination with, 4 out of 5 healthcare workers are women. So that combination of that stress level in the healthcare world, and then coming home and having the additional stress of children being home, and all those, they seem to be worried about, are we going to have some post-traumatic stress issues, especially in women healthcare providers that are now going home to an added stressful situation. And so they're trying to be proactive in this lull and trying to ferret that out. So if anyone's feeling, stressed, a little extra stressed, and it'd be, it's not a bad thing to seek out some, assistance to try to nip that in the bud, because that all ties into your immune system and your inflammatory responses and everything else. So it's all intertwined. And, now that we've gotten over the hurdle and we blotted the wave a little bit, now it's time to take care of people that did all the stress load during that.
Yeah, and I mean, they're talking about a second wave. And the second wave, there may be mutations from the first wave.
Mm-hmm.
So is there anything in addition to some of the things that you've already suggested that people could do to protect themselves from potential harm at a hospital or a doctor's office?
Well, I would, doctor's offices, if you have a chronic, if you're undergoing cancer treatment or anything that needs the therapy, you should be certainly going back by now and taking care of that. I would suggest, if it's not serious, trying to avoid the doctor's office. There's all telemed services now that you can get for minor issues or things of that nature. But I certainly would suggest, if you're going to a doctor's office, wearing gloves and a mask. So that way the contact points are definitely protected. I would also, make sure you have hand sanitizer in the car if you're driving yourself, to make sure that before you touch anything, even in your car, you get rid of the gloves and you take care of making sure you disinfect everything. But so I would, I think, the issue of mutation is actually more troublesome and more worrisome in terms of, the old-fashioned Darwinism, the stronger survive and the weak get killed off. So, that's why we're sort of like in a race now. The epidemiologists are now in a race to try to figure out how to stop it in its tracks, as opposed to letting it mutate. It's kind of, so far over the first 6 months, it doesn't appear, at least, the problem is we're not getting, what's the information we're getting from China, how accurate was it? And so the symptomatology and the end results don't seem to have changed or mutated in terms of how it's affecting people. I think we've gained better insight as to how it's happening in terms of whether it's arterial and blood vascular, as well as, something to do with the lungs. But so I think that's something that we're going to bear watching and see if the things that 3-pronged treatment approach is actually working and continues to work, and if it stops working at the rate it's supposed to be, what happens. The study that, mostly studied that the blood thinners, the steroid and the intubation came out of Oxford, and there was a 35% reduction of deaths on people who were actually on ventilators. Now, if that changes, where that rate it somehow starts ticking up, then you got to worry about why is that, and if it's a patient population that was maybe elderly or had real comorbidities in your particular hospital, that might help explain it that it hasn't changed. But I think now we have to be, you're absolutely right, this is the time frame where we have to be worried about things changing, and that's why the vigilance with the mask, even though some people think, oh, we're past the peak, we're a little safer now. This is actually the time when you have to be the most vigilant to try to stamp it out as opposed to letting it come back.
Absolutely. I have two more questions. One is about the gloves, right? So you said, when you go into a doctor's office, wear gloves. It was interesting because my son recently went for a physical and they told him to take off the gloves, which I thought was very interesting.
Yes, that's a little well, there may have been a reason that they wanted to look at something in particular, capillary refill or something. I'm not sure, but
I thought that was interesting, right?
yeah.
And the other thing that I wanted to ask you about was, I was reading in the Washington Post about some people are already getting the vaccine, through trials.
Mm.
What happens if, God forbid, somebody who does this trial dies?
Mm. Well, unfortunately, a lot of times when you do a trial, you sign away some of your rights. So if you're going to do a trial to try to jump ahead of something, read what you're signing. Okay, and make a decision if you want to do that or not. So now vaccines have their own special court system, and it's a very short time frame. And actually, there's a specialization within medical malpractice that it's called the vaccine court. So it's a federal preemption. So that Congress has said to the laboratories out there, for any vaccine, if you're going to produce a vaccine and help Americans in this way and do this production, we're going to provide some protection for you. Not ultimate protection, but some protection, that you have to go to a specialized court and follow certain procedures in order to say if you've been harmed by the vaccine or not. And there are always issues in terms of people who should not be exposed to certain elements that might be in the vaccine. And so those are all avenues that people have to pursue. But the vaccine court, there are very limited ways in which you can succeed in that body of law.
Right. So it's the all right. So now we get to a point where there's a vaccine, right? Maybe this will be in January, hopefully sooner. And you get the vaccine, but then you get very, very sick as a result of it. Or on the other hand, those people who are donating their platelets, what happens to them? I mean, so, is that anything that we should be concerned about?
Yeah, well, you always should be concerned, you always should be mindful and watchful of the vaccines. Many of the mothers that take their babies in to get vaccines, the doctor wants to give you 5 in one day. And you say to the doctor, no, we're going to do 1 a month for the next 5 months. We're not going to do 5 in one day, and those kind of things. So you have to, you have to guide yourself accordingly. So I think those are issues that you have to do on a one-by-one basis in terms of what you feel safe and protective of. The vaccine, taking the vaccine itself, there's not too much you can really do once you've taken the vaccine to protect yourself from your reaction to it, other than if you have a reaction, you have to go get the appropriate help for that reaction. Mm-hmm. Hopefully at the point when they produce it, because of the trials, they'll know what reactions are serious and which are short-lived. You may have something simple like, some people get a redness around where the injection goes in. That's, that we can deal with. It may not be comfortable there, but you can deal with that. But there might be some people that got very severe reactions that if you get something, maybe a cough right after, that triggers, hey, you actually gave yourself COVID, and let's go in and get your treatment going, so to speak. So, that's, those are things I'm sure the trials are learning. And some of the things, as you said, you're signing away your rights if you decide to engage in a trial. But that's that you've made. If you're grown up, you've made your decision that way.
Well, you gave us a lot of food for thought today, really, and I just want to thank you. Could you give our listeners a way to get in contact with you and the firm?
Yes, absolutely. We have a toll-free number, but nowadays you don't really need that as much. But that's 866-MEDMAL7, just MEDMAL 7. Our line right here on Long Island is 516-684-2900. We obviously have our website, Pegalis Law Group, and I have an individual email. Of course, you could always contact me through that. And so, my email is simply Fallarino, FALLARINO @PegalisLawGroup.com.
Thank you. Thank you so much for being on the show. I want to thank the Pegalis Law Group as well for sponsoring. Pegalis Law Group, again, they represent people suffering from preventable medical errors and personal injury. They strive for accountability by advocating for clients, which ensures safer medical practices and better patient care. You could contact pegalislawgroup.com. Thank you again, and thank you, our listeners, for tuning in. If you want more information on this show or any other show, you can find us at hilarytopperonair.com, or you could look at Spotify, iTunes, Apple Podcasts, Google Play, SoundCloud, and even Amazon Alexa. Have a great week, and we'll see you next time.